Hi, hello everybody. Today it is my pleasure to talk a little bit about the use and the value of imaging in the evaluation of disease activity in rheumatoid arthritis. We know that the disease, rheumatoid arthritis, has changed its features during the last decades. And this is due to the changes in the treatment of rheumatoid arthritis that started in the last decade of the last century with the use of biologic drugs that really created a revolution in the therapeutic strategies of this disease. But also, this is due to the importance of an early diagnosis and to the use of the treat-to-target recommendations. These recommendations indeed underline the importance of remission and the importance of obtaining remission as soon as possible, but also to have remission during the disease course. Indeed, the importance of the evaluation of disease activity state is also included in the last EULAR recommendations for the management of rheumatoid arthritis that were published last year. And it is indeed stated that treatment decisions are based on disease activity evaluation, and that treatment for rheumatoid arthritis should be aimed at reaching a target of sustained remission or at least low disease activity in all patients. So, remission is the ideal target of treatment in patients with rheumatoid arthritis. This is absolutely clear. However, the definition and characterization of remission is sometimes still a theme of discussion, and the assessment of the remission can be a little challenging in the clinical practice. And we know that although we have new treatments and new therapeutic strategies that make remission possible, sometimes we have inflammation in the joints that cannot be detected by routine clinical evaluations. And when we have this subclinical inflammation, there is damage that can appear and progress. But there is also sometimes it happens that there are flares following periods of remission. So we have also to underline the importance of sustained remission. This means remission that is present during the disease course, and not only remission that is present in small times when patients are evaluated. But how do we measure disease activity in the clinical practice? Well, EULAR and ACR defined the concept of remission by developing a number of clinical composite indexes. These are commonly used in the clinical practice. They are a little bit difficult sometimes to be calculated because there are a number of measurements that should be taken. But we have also simplified indexes for evaluating remission and evaluating the level of disease activity. So we have the possibility to evaluate clinically the presence of inflammation and disease activity, and if patient is responding to the treatment, we have the possibility to evaluate the presence of remission or at least low disease activity. But we also have a very another important tool for evaluating disease activity, that are the patient-reported outcomes. Those measures have been shown to be particularly helpful, particularly in this year of pandemic, when the physical visits, the live visits of the patients to the clinical department were of course difficult because of the pandemic, and therefore by virtual assessments or by email or phone, patients could report their questionnaire, could fill in specific questionnaires, and therefore there was the possibility to evaluate even by remote the presence of disease activity and evaluate if patients were in remission. By doing so, it was possible even during the last difficult year to modify, adjust the treatment and optimize the therapeutic strategies for patients. So clinically, It is possible to evaluate remission, to evaluate the clinical status of disease activity, and this is doable even by simplified measurements. However, this does not allow to measure subclinical inflammatory activity. That means that we know that in some patients there are some signs, in some moment, disease inflammation, joint inflammations that cannot be detected by clinical evaluation. So, what is the role of imaging in this context? Over the last few years, the management of rheumatoid arthritis has changed, also because we use sometimes imaging techniques that demonstrate the presence of inflammation also when clinical evaluation cannot do so. And in the last years and the last centuries, there has been an enormous development in technology that has led to the use of very sophisticated imaging modalities in recent years particularly, that allow the evaluation of patients and joints in rheumatoid arthritis, and so are able to demonstrate even minimal signs of inflammation. So in a patient who is in clinical remission, those imaging modalities can still allow the detection of inflammation by showing synovial inflammatory status in different areas of the joints and periarticular areas, but also it is possible by imaging to show structural damage. That means that this damage that is due to the inflammatory conditions can progress during the disease course, and then, if it is not controlled, it can lead to disability. Is this a real remission then? Of course, we use imaging for improving the evaluation of the inflammatory activity in patients with rheumatoid arthritis.
So,
My name's Kate Betteridge. I was diagnosed with adult form rheumatoid arthritis back in 1986 when I was 13. When I actually saw my real GP, he was really clued into this, and he and my mother recognised the symptoms, sent me for the correct tests. The diagnosis came within about 8 weeks, which is fairly quick. From a young age, I've always been really interested in words, and I wanted to become a journalist. I won a competition to write for Wales's national newspaper, the Western Mail, and I had to go away for a week. And suddenly there's me, 17, having to fend for myself, cope for the first time by myself with my rheumatoid arthritis, with a group of people I didn't know in a really unknown setting. And it's suddenly like the light went back on. It was great. They saw me as me, not as a disease, was really important. And my hope for the future is that doctors certainly become more aware, GPs, family doctors become more aware of some of the symptoms. Early diagnosis and early treatment is essential. The support I got from health professionals really was fantastic, and I think helped shaped how I am today. And it is really important not to let rheumatoid arthritis, juvenile arthritis, take control to tell you who you are. It is part of my life, but it certainly doesn't rule it.
So welcome back, and we can now go ahead with the presentation and talk about the use of imaging in the evaluation of remission. Well, we said before that patients who are in remission and who are following a treat-to-target strategy, patients with rheumatoid arthritis, of course, we can still find some signs of inflammation, but also signs of damage in the joints, and these can be evaluated by imaging. So, can we consider that this is a real remission? If we look at the EULAR recommendations for the use of imaging of the joints in the management of rheumatoid arthritis, we see that the recommendation number 10 say that the use of magnetic resonance and ultrasound, that are two of the most modern imaging modalities that can be used for evaluating the joints in patients with rheumatoid arthritis, these tools, these modalities can detect inflammation, and this inflammation in the joint can predict the development of damage in the joint. And this is possible to be detected even when patient is in remission. And these two modalities can be used to assess the persistent evidence of inflammation. What about the use of magnetic resonance imaging in rheumatoid arthritis? This is an extremely sensitive imaging modality for evaluating inflammation in the joints, but also in the periarticular areas that are involved in rheumatoid arthritis. For example, tendons with sheaths, bursitis can be detected, and many areas where there is an inflammation. But what is extremely important for magnetic resonance is that it is able to show the inflammation also in the bone with the detection of bone edema. And it is also possible by magnetic resonance to detect the progression and the evidence of damage in the joints, in the bone, in the tendons, and in the different areas of the musculoskeletal system. It is an extremely sensitive imaging modality for evaluating different inflammatory or damage abnormalities, but it is a little bit expensive, and it is not always available in the clinical practice for evaluating many patients. There are different studies in the literature that demonstrate that ultrasound is able to show different abnormalities in patients in remission, in patients with rheumatoid arthritis. And particularly, a study published in 2018 showed the persistence of subclinical inflammation in patients who were in remission evaluated clinically. So although the clinical evaluation shows that the absence of any activity in the joints, there was inflammation detected by magnetic resonance. And particularly, the inflammation in the bone, the abnormality that we call bone marrow edema, this can predict future damage and the development of erosions that lead to disability. So the use of this imaging modality can be very helpful for evaluating real remission in patients with rheumatoid arthritis. There is, however, another study that was published in the same year that was aiming at evaluating the use of magnetic resonance for guiding a therapeutic strategy. And these findings were compared to the use of clinical assessment for guiding the therapeutic strategy. And this study demonstrated that if we use magnetic resonance for guiding the treatment, and this guidance is compared to a clinical guidance, there was not an improved activity remission rate. And therefore, this study didn't support the use of magnetic resonance for guiding the treatment strategic decisions for patients with rheumatoid arthritis who are in remission. Let's now talk about another tool, ultrasound. Ultrasound is very friendly because it can be used in the clinical practice. It can be very helpful in evaluating different areas of the joints. And it is possible to evaluate many joints during the same examination directly by the rheumatologist. It shows inflammation, but also damage abnormalities in the musculoskeletal system. However, not all areas can be visualized by ultrasound, and particularly the bone, the internal part of the bones are not visualized. There are different studies that show the importance of ultrasound for evaluating subclinical inflammation, particularly a study that was published in the last years, evaluated many other articles that were published. This was a systematic review and meta-analysis, and this demonstrated that in more than 1,400 patients with rheumatoid arthritis in remission, there was inflammation that was demonstrated in different joints. And this inflammation was able to predict the presence of progression of structural lesions, the progression of damage. And this was in patients who were in remission by clinical evaluation. And this was confirmed by another interesting study published in the Journal of Rheumatology 4 years ago, that showed that in patients who were in clinical remission, there was the detection of synovitis and inflammation by ultrasound, and this patient had a high risk of relapse, of flare in the following months. And in addition, there was an association between this inflammation detected by ultrasound and the risk of progression of erosions and damage. There is also another study that was recently published that was performed in patients with very early rheumatoid arthritis. And this study demonstrated that, on the contrary of other recent evaluations that were published, when we use ultrasound to drive the therapeutic strategy, this doesn't give an added value to the clinical guidance. But again, this was a result that was not confirmed in a study published this year in 2021, which demonstrated that if we use ultrasound to drive our strategic decisions for the treatment, this can be very helpful because we can have a better control of the disease activity, and there is a reduction of the relapse, and patients have a long-term step-down therapy. By using ultrasound, in addition, we are able to evaluate also periarticular structures. And tenosynovitis is frequently present in patients with rheumatoid arthritis, and this can be detected also by ultrasound that shows in patients who are in remission also the presence of inflammation in these periarticular areas. And when we have inflammation in tendons with Doppler positivity, with active inflammation, this again is a predictor for a flare in the following months. Generally, then, remission can be detected, evaluated carefully by ultrasound and by imaging in general, and in particular, ultrasound can be helpful for assessing subclinical inflammation, as it was demonstrated by another study that was published a few years ago that showed the evidence of the use of imaging to ensure a really an accurate disease activity assessment in patients who are in low disease activity or in remission. And that when we have a comprehensive evaluation of disease activity by using, for example, patient-reported outcomes, clinical assessment, and progression in the radiographic damage, then we have a complete evaluation and an assessment that is done in a better way and can lead to an improvement of the strategies in the treatment of patients with rheumatoid arthritis. And now we are going to have a small break and see you very soon.
Hello, my name's Aaron Churhan and I'm 11 years old. So I like to do football, raising money for charity. And the charity I do is CCAA, which is Children's Chronic Arthritis Association. And the reason I do it is because I got juvenile arthritis myself.
We feel confident that because of the early diagnosis, that some of the later complications have probably been avoided as a result.
Making contact with the healthcare professionals, it has such a change, such an impact, you know, and it allows Aaron to fully, you know, live a day-to-day life.
And all my doctors have been patient with me and then they've helped me and make me feel like I don't even have to be worried about it.
Hello, welcome back. Thank you for staying here with us. And now I will move to the use of more modern imaging modalities in the evaluation of disease activity and inflammation in rheumatoid arthritis. Well, recently there are nice and interesting publications that show that PET imaging is a very interesting tool for evaluating subclinical inflammation. And this is a new imaging modality that shows an enhanced tracer uptake at different joint sites. And this shows residual inflammation. So this is the future maybe of the use of imaging for evaluating inflammation that is not detectable by clinical assessment. We also have a very nice, another very promising tool that is optical imaging. By using this tool, we see that it is possible to detect the inflammation by abnormalities and that are shown by the light traveling through the tissue. And this tool can be able to distinguish between healthy subjects and the joints of patients who have rheumatoid arthritis and that are inflamed. We mentioned on the use of ultrasound for evaluating inflammation and damage in the joints, but by new tools in the field of ultrasound, for example, by using three-dimensional ultrasound, we can have a global assessment of the presence of inflammation in different joint sites. And this again can represent the future of the assessment of joints, because it gives a more global overview on the presence of abnormalities. And also the contemporaneous assessment of the joints with different imaging modalities, what is called fusion imaging, can be able to give a very detailed overview of different abnormalities. For example, we can use CT and ultrasound, or magnetic resonance and ultrasound, and overlap the images that come from those two different tools and have a global evaluation of inflammation and structural lesions. And these again in the future can most likely represent a very interesting way to detect subclinical inflammation. And there are even more modern tools that are able to show very early in the disease course the progression of structural damage regions, for example, high-resolution CT scans. So globally, we know that the role of imaging in assessing remission can become very important, and it is possible to evaluate an enormous spectrum of lesions. Ultrasound essentially is able to show abnormalities in the joints, but also in the periarticular areas that are frequently involved even in patients who are in remission. But a magnetic resonance is able to demonstrate the inflammation in the joint, in the bone. That is meaning the presence of bone marrow edema. And we are able, therefore, by using different modalities, to evaluate different kinds of abnormalities. Even in patients who are in remission and where persistent inflammation is present, imaging can detect this in the different stages of the disease, because we have studies that demonstrate that subclinical inflammation can be detected very early in the disease course, but also at a later stage. And it is possible also to detect structural damage lesions in patients with different phases of the disease. So, in conclusion, do we have an added value by using imaging in the detection of inflammation in subclinical disease compared to the clinical assessment alone? Well, the capability of imaging to demonstrate subclinical disease activity even in patients who are in remission has been demonstrated, and this has been shown at different joint level and in different disease stages. So, of course, the clinical evaluation remains our gold standard, our reference. However, we have to consider that sometimes it is inadequate to capture subclinical inflammation. And there could be a persistent persistent joint inflammation that is not detectable by clinical assessment. So imaging can complement the assessment of patients who are in remission, and it can give additional data that still can reveal a certain amount of subclinical disease activity. So what would you like to use? For sure, for us, clinical indexes are still our reference standard. Imaging features alone cannot be used, of course, but they can be combined to clinical evaluation and therefore give a global view of the disease activity status in patients with rheumatoid arthritis. And we know that is extremely important because our recommendations say that we have to aim at remission, and this should be a real remission. And with this, I would like to thank you so much for your attention, and I would like to invite you to watch the session that is now available on demand. Thank you very much.